guys. So today we have a guest speaker, Dr. Sordean. Let's first go ahead and play a little icebreaker. It'll be something very quick. So if I could have you say your name, but before you say your name, you say an adjective with the same first letter. For example, my name is Bilal, so I could say boisterous Bilal, for example. So I guess we'll start with you.
Okay. Does that have to be true?
No.
Okay. Generous Genevieve.
Well then.
On that note, active Allison.
Sather, Sandeep.
I'm sure Priya.
Jovial J.
Lazy Lily. Control Breathable.
Rambunctious or
Okay, well, Bilal gave me an adjective last year, so it was ratchet.
Alright, so that was yeah. So our guest speaker today is Dr. Sordean.
Sordean.
He's worked with alternative medicine, which is a term that I hope you unpacks because I personally don't know what that even means. Specifically what it means, I know it's rumors, but like, I think you know what it actually means. So, take a mic.
So I'll just do a brief intro. So my name is Esther Slayman. I'm a Cal alum as of last May, and I was co-managing editor of Sather Health for about a year and a half when I was here at Berkeley. And that was when Sather Health was first launching too, so it's cool to be back and see you guys here tonight. Currently, I'm working as office manager of the Berkeley Clinic, which is Dr. Sordean's office. So I know that when I joined Sather Health and then when I joined the leadership team, it was because this was an opportunity not only to do something that I enjoyed, which was writing, and I found it interesting, but I also joined it because at the time I was dealing with some health concerns, and I thought that joining an organization like Sather Health would help me find some answers. And then eventually when I did more research and more writing, I hoped that my looking for the answers and finding them would help my fellow students, which is what you guys are doing still today. So maybe you're here also because you or someone you care about is dealing with a health problem, maybe like migraines or depression or anxiety or chronic back pain, digestive disturbance or fatigue. And so I'm glad to be able to say that when Ron M. Kang asked me if I knew someone who could be a guest speaker at Sather Health this semester, that I could refer him to Dr. Sordean, whom I've worked for almost a year now. So in over 30 years of practice, Dr. Sordean has treated many patients with the conditions I mentioned, as well as more, and has used natural methods, and we will talk a little bit more about what that means exactly, to help patients heal from pain, both chronic and acute in nature, and to avoid unnecessary surgeries. Dr. J has helped patients to stop taking medications with debilitating side effects, medications they didn't want to take because they were damaging their health even more. The treatments and conversations with Dr. J have helped them to feel their best and to have more fun, which is, after all, what life is all about. So I've seen patients come in for my time at the Berkeley Clinic, honestly, because they're fed up and they've already gone to 2, 3, 4, 5 or more doctors already, and they still haven't been able to treat their condition. So Dr. Sordean looks for and is often able to find what other practitioners have missed, which is why our patients continue to seek care from him and why physicians refer some of their most complex and nuanced cases to us. So Dr. J actually has one of the longest standing natural medicine clinics in the area for 30 years, as I said before, and having 40,000 clinical hours of experience under his belt. In addition, he's an active community volunteer, providing free workshops and health screenings to promote disease prevention and health awareness. So because I know we only have like 45 minutes or so this evening, I will pass on the mic here. But I do want to just mention that if you have more questions after the talk about alternative medicine or about any things we talked about, there's a lot of resources that we have online on our website at www.theredwoodclinic.com and on YouTube too. So I know that if you guys have an assignment, so blog or an article, and you're struggling to come up with a topic, then that might be a good resource for you. So thank you again for inviting us here tonight.